Welcome back, everybody, to another deep dive. We're going to jump right in. Today, we're looking at content from Pharmacy Technology and Management Review to talk about some trends and challenges facing the industry. We've got 3 articles that we're going to dive into today, and they cover some really important topics like drug shortages, the role of pharmacy management systems, and the sustainability of the traditional retail pharmacy model.
It's a lot to unpack, but definitely some key issues that are affecting pharmacies everywhere.
For sure. So let's start with the first article. It's called Drug Shortages and Solutions by Marshak Milinig. And this one really caught my eye because it talks about the rise of counterfeit products, especially with the huge increase in demand for GLP-1 agonists like Ozempic and Mounjaro. It's really alarming. Milinig points out that calls to U.S. poison control centers about semaglutide actually jumped 1,500% between 2019 and 2023.
Yeah, that's a massive increase. And it really highlights the dangers that patients face when they're trying to get these medications. The article even mentions a case of counterfeit Ozempic that was circulating with fake paperwork, which makes it almost impossible to track where it came from. It really underscores the threat that counterfeit drugs pose to patient safety.
Right. And this problem goes beyond just GLP-1 agonists. The article cites the American Society of Health System Pharmacists. They reported record 323 active drug shortages in the first quarter of 2024, which is actually higher than the previous record set back in 2014.
So it's a widespread issue for sure. To understand what's causing these shortages, Milinig brings in some insights from the U.S. Pharmacopoeia's annual drug shortage report, and they explain that low profit margins on generic sterile injectables and solid oral medications, which are often the ones in shortage, are a major factor driving this problem. These low profits just discourage production, leading to those shortages, which then further fuels demand and creates,
a perfect environment for counterfeiters. It's a vicious cycle. And what's even more concerning is these shortages aren't just an inconvenience. They have real-world implications for patient care. They can lead to treatment delays and even force providers to make some really tough choices about how to ration limited supplies.
Yeah, absolutely. The article does go on to explore some potential solutions, though. The USP recommends policy reforms that focus on incentivizing a high-quality supply chain, increasing supply chain visibility, investing in early warning systems, and strengthening a geographically diverse manufacturing base.
These suggestions could really make a difference, but they require, collaboration across the entire healthcare ecosystem. It's almost like the USP is calling for a system-wide approach to tackle this really complex problem.
It is. It's a call to action for everyone involved in the pharmaceutical supply chain, from manufacturers to distributors to healthcare providers, to work together and prioritize patient safety.
For those of you listening out there, think about how these drug shortages are impacting your pharmacy. What strategies have you put in place to deal with this challenging situation? What can you do to make sure your patients have access to the medications they need, and at the same time protect them from the dangers of counterfeit products?
Those are some really important questions to think about. Now let's move on to our second article from Pharmacy Technology and Management Review. This one is called Social Determinants of Health and Pharmacy Management Systems by Brent Fox, and it focuses on how technology can be used to address social determinants of health, which, as we know, can have a huge impact on patient outcomes.
Yeah, it's becoming clearer and clearer that healthcare is about a lot more than just dispensing medications. Social factors play a major role in an individual's overall health and well-being.
Absolutely. Fox starts by explaining this whole concept of social determinants of health, highlighting the 5 key domains, which are economic stability, education access, and quality, social and community context, healthcare access and quality, and neighborhood and built environment.
All of those factors can have a huge impact on a patient's ability to access healthcare, adhere to their medication regimens, and manage their conditions effectively. It's definitely something that pharmacists need to be aware of and actively address.
For sure. And that's where technology comes in. The article argues that pharmacy management systems can be really powerful tools for addressing these social determinants of health. They can help bridge gaps in care, promote medication adherence, and empower patients to take an active role in managing their own health.
Like, for example, features like e-prescribing can remove barriers for patients who might have trouble with transportation or who live in areas with limited pharmacy access. And automated refill reminders and medication synchronization programs can be really helpful for medication adherence.
Yeah, it's about using technology to streamline processes, make things more accessible, and make it easier for patients to stick to their treatment plans.
And it goes beyond just the logistical aspects of care, too. These systems can also help with patient education and support, giving patients the information and resources they need to manage their conditions effectively.
Imagine a pharmacy management system that integrates educational resources, personalized medication counseling, and even connections to community support services. It could really empower patients to take control of their healthcare journey.
That's a powerful idea. It really shifts the role of the pharmacy from just dispensing medications to being a true hub for patient care and support.
Exactly. And the article goes even further, highlighting the potential for data integration. Connecting pharmacy systems with electronic health records can create a more holistic view of the patient and allow pharmacists to collaborate more effectively with other healthcare providers.
Imagine having access to a patient's complete medical history, lab results, and previous prescriptions. It would allow pharmacists to identify potential drug interactions, provide more targeted counseling, and just ensure that patients are receiving the most appropriate care.
It's all about breaking down those silos that often exist in healthcare and creating a more integrated, patient-centered approach. The article also emphasizes that pharmacy management systems can contribute to reducing health disparities by promoting equitable access to medications and using culturally sensitive communication tools.
That's a really important point. We need to make sure that everyone has equal access to quality care, no matter their background or circumstances.
Right. Features like automated system for patient assistance programs and medication affordability assessments can help identify financial barriers and connect patients with resources to overcome them. And using culturally sensitive communication tools can help bridge language barriers and make sure everyone's getting clear and understandable information.
It's all about meeting patients where they are and giving them the support they need to navigate the complexities of the healthcare system. So as you think about your own pharmacy, consider how you're using technology to address social determinants of health. Are you taking full advantage of your pharmacy management system's capabilities to identify and address these critical factors?
It's definitely something to think about. Now let's move on to our final article, Is the Traditional Retail Pharmacy Business Model Sustainable? By Ann Johnson.
Okay.
And she really lays out the challenges that retail pharmacies are facing right now.
Like what kind of challenges?
Well, for starters, she points to a string of recent announcements that have really shaken up the landscape. Like Walgreens struggling with their Village MD clinics and their plans to close stores. And then there's CVS closing about 900 stores by the end of 2024. And they're really focusing on vertical integration through clinics and CVS Caremark.
So basically trying to control more the healthcare process themselves.
Exactly. And then we have Rite Aid filing for bankruptcy and closing almost 800 stores.
And even the proposed Kroger-Albertsons merger would likely lead to more consolidation and potential store closures. It's a trend that's affecting independent pharmacies too, with hundreds closing down in recent months.
It's a tough time for the industry, that's for sure. Johnson really digs into the factors driving these closures and highlights the financial pressures that retail pharmacies are facing. Third-party reimbursement rates continue to be a major problem, and public pressure to lower drug costs is just making things worse.
Plus, we can't forget about the fact that the revenue from COVID-19 related services has pretty much dried up. That temporary boost is gone, and now many pharmacies are scrambling to make up for it.
Even dispensing those high-cost specialty medications can be a money loser for pharmacies because of the low reimbursement rates. It's a tough concept for a lot of patients to understand, that pharmacies can actually lose money while selling expensive drugs, but that's the reality.
It's definitely a complicated issue, with no easy answers. Johnson does offer some insights into potential ways forward, though. She suggests that the industry might need to reach a point of equilibrium in the number of pharmacies before reimbursement rates can improve.
That's an interesting idea. Maybe consolidation and right-sizing are necessary steps towards a more sustainable future for retail pharmacy.
Johnson also explores alternative models, like central fill or mail-order pharmacies for maintenance medications, which would help lower costs and make things more efficient. But the question is, how do we balance convenience with the need for pharmacist accessibility? Patients still really value that personal interaction and expertise.
It's a tough balancing act for sure. Finding the right approach is going to be critical for the future of pharmacy. As you think about the information in this article, ask yourself, is your current business model sustainable in the long run? What innovative strategies can you implement to not just survive, but thrive in this rapidly evolving market?
Those are questions that every pharmacy owner and decision maker needs to be asking themselves. We've covered a lot of ground today, talking about drug shortages, technology's role in addressing social determinants of health, and the sustainability of traditional pharmacy model. So what's the takeaway for pharmacy owners and decision makers?
The takeaway is that they need to be proactive. They need to evaluate their current business model and think about what changes they need to make to stay competitive.
And that can mean anything from embracing new technologies to exploring alternative service models to finding ways to differentiate themselves from the competition.
Exactly. The status quo is no longer an option. Pharmacies that want to thrive in the future need to be willing to adapt and innovate. It's been a great deep dive into some really valuable content from Pharmacy Technology and Management Review.
If you're interested in learning more about these topics, we encourage you to check out ptmreview.com. You'll find the full articles we discussed today, along with tons of other resources to help you stay ahead of the curve. Thanks for joining us on this deep dive. We hope you found it valuable. Until next time, keep learning, keep innovating, and keep providing excellent patient care.